Good morning, my lovely people. Welcome back to our YouTube channel, and it's my hope that each one of us is doing well and in good health. We are still winding up our topic about kidney failure, and today we'll be looking at other lifestyle habits that may help you manage kidney disease. We started by discussing the major ones, including diet and medication, but there are others which you can include or you can involve together with medication, lifestyle changes, and the diet, so that you may achieve your goal of preserving your kidney function. And before we continue, as I always say, if you are watching this channel for the first time, just take a second or two, you subscribe and put the notification bell on, so that whenever I produce a video like this, YouTube will automatically notify you and you'll never miss any of our videos. And for the returning subscribers, I will continue appreciating you for the good job you are doing to this channel, because it's because of you that this channel is where it is at the moment. Like other lifestyle habits that may help manage kidney disease. Number one, following healthy eating habits or eating plan for diabetes, or working with a registered dietitian or nutritionist. Following healthy eating plan or habit for diabetes, or working with a registered dietitian or nutritionist. Definitely a dietitian or a nutritionist will guide and counsel you on the foods you should eat and foods you should not eat when having diabetes. There are foods that can trigger the glucose levels to rise. So the dietitian will assist you to avoid such foods and eat healthy, and through this your blood sugar levels will be maintained at their normal levels, and this will in return help in achieving the goal of maintaining your kidney function, because the main aim here, or the goal here, is to maintain the kidney function, or to make sure that your kidneys are functioning normally even if you have diabetes. It doesn't matter, it doesn't mean that if you have diabetes your kidneys must fail. No, you can have diabetes, and if you have the required discipline, your kidneys can remain normal forever. Number two, getting at least 30 minutes or more of physical activity each day. Getting at least 30 minutes or more of physical activity. This is like an exercise. So make sure in your schedule, even if you are too busy, make sure you get 30 minutes or more to have a physical activity, like an exercise. If you do an exercise and sweat, you will be burning the toxins in your body and assisting your kidneys in filtering these toxins, because through sweat you will lose some of these toxins and the work for the kidneys will be much easier. And also this will help in cutting the fats in your body. So getting 30 minutes or more of physical activity each day. Number three, quitting or avoiding smoking if you smoke. Not everybody smokes, but this is for those who smoke. You quit or avoid smoking if you do. Next point, we have getting at least 7 to 8 hours of sleep each night. Getting 7 to 8 hours of sleep each night. This means that bed rest is also very important in managing or preserving your kidney function. So, getting at least 7 to 8 hours of sleep each night. Number 5, finding ways to cope with stress, which can contribute to hypertension or high blood pressure. So, you have to find ways to cope or have shock absorbers to cope with stress, which can trigger or contribute to high blood pressure. And this is known to each one of us that stress can trigger hypertension or high blood pressure. I hope up to that point we are together. Next point, seeking support or treatment for depression if you experience it. Depression definitely goes hand in hand with stress, because if you are depressed, you are stressed. So, seeking support or treatment for depression if you experience it. This is what will also help in preserving your kidney disease, because stress will lead to hypertension, and we said that hypertension and diabetes are the leading causes of kidney diseases. A point to note, if you have 8-stage kidney disease, treatment may involve dialysis or kidney transplant. And we say this, and we have been saying it all along, that if you have 8-stage kidney disease, treatment may involve dialysis, whereby a machine is used to filter your blood, then the blood is pumped back into your system. Or you get somebody who can donate you his or her kidney. And I asked some days ago, how many of us can volunteer to give out their kidneys to either their siblings, be it a brother or sister? How many of us can do that? It's not so easy. It's not so simple. So the best way here is just to make sure we preserve our kidney function. Prevention of diabetic nephropathy. Prevention of diabetic nephropathy. Remember, we always say prevention is better than cure. How do you prevent diabetic nephropathy? The main ways to prevent diabetic nephropathy include the following. There are ways you can use to prevent diabetic nephropathy and include the following. And they are the same things we have been talking about. Number 1, diet. Everything is rotating around diet. Because nowadays, we always mess up with our diets. That's why we have said it's good to have a dietitian or a nutritionist who will counsel you on a diabetic diet. The best way to preserve kidney health is to be mindful of your diet. The best way to preserve your kidney function is to be mindful of your diet. People with diabetes who have partial kidney function need to be even more vigilant about managing the following. This is a very important point to note, that people with diabetes who have partial means that the kidneys are failing, but they have not completely failed. Maybe they are working halfway. That's why we are saying people with diabetes who have partial kidney function, or who their kidneys are partially working, need to be even more vigilant about managing the following. They should be vigilant for the remaining part of the kidney, can continue assisting them in filtering the blood, removing the toxins from the blood. So, people with diabetes who have partial kidney function need to be even more vigilant about managing, number one, blood glucose levels, number two, blood cholesterol levels, and number three, lipid levels. Number one, blood glucose levels, number two, blood cholesterol levels, and number three, lipid levels. Most people should aim to maintain a blood pressure of 140/90 millimeters of mercury. Most people should aim to maintain a blood pressure of 140/90 millimeters of mercury. The doctor treating you high blood pressure may recommend an individual own goal. The doctor or the physician or the healthcare provider treating you high blood pressure may recommend an individual own goal. Even if you have mild kidney disease, high blood pressure can cause the disease to progress more quickly. Get this very clearly, that most people should aim to maintain a blood pressure of 140/90. The doctor treating you, this is very important, the doctor treating you high blood pressure may recommend an individual own goal. Even if you have mild kidney disease, we should aim at preserving the little function the kidney is doing. Even if you have mild kidney disease, high blood pressure can cause the disease to progress more quickly. So the pressure should be maintained less than 140/90 because high blood pressure can make this disease progress more quickly. This marks the end of our video today, and in our next video, we will be seeing the recommendations by a doctor in managing diabetic nephropathy. Oh, what recommendations a doctor can give to his or her client in order to assist his client manage diabetic nephropathy. Thank you for your time. Thank you for watching this video. Let's continue sharing with our brothers and sisters, commenting, so that this video may reach as many people as possible and help the community at large. Let's have a wonderful day ahead.